Good morning to all of you. Today, I am going to talk about a medicine that most of us have taken at some point in our lives, a small, seemingly harmless tablet that provides quick relief from pain, fever, or inflammation. This medicine is known as ibuprofen. Many people know it by brand names such as Brufen, Advil, Motrin, or Nurofen. It's a medicine that sits quietly in almost every household, always ready to help us when we experience pain. But behind its power to relieve pain lies a hidden truth. That excessive or careless use of ibuprofen can cause serious health problems. The purpose of my speech today is to make you aware of both the benefits and the potential dangers of this commonly used drug so that we can use it wisely and safely. Ibuprofen is a type of medication known as a non-steroidal anti-inflammatory drug, or NSAID for short. It was first introduced in the 1960s as a safer alternative to aspirin. It works by reducing the levels of chemicals called prostaglandins in the body. These chemicals are responsible for pain, fever, and inflammation. By blocking the enzyme that produces prostaglandins, ibuprofen helps reduce pain and swelling and brings down fever. This is why it is often used to treat headaches, toothaches, menstrual cramps, muscle pains, joint pains, arthritis, and even mild fever. It's a versatile drug and, when used properly, can greatly improve comfort and quality of life. However, the same mechanism that makes ibuprofen effective can also cause problems when it is taken inappropriately or excessively. For most adults, the safe dose of ibuprofen is between 200 to 400 milligrams every 4 to 6 hours is needed, not exceeding 1 to 200 milligrams in a day without a doctor's supervision. For higher doses, such as 24 milligrams per day, medical monitoring is essential. For children, the dose depends on body weight and must be carefully calculated. Unfortunately, many people ignore these guidelines and take higher doses or take it more frequently to get faster relief. Some even combine ibuprofen with other painkillers, which increases the risk of side effects and complications. What people often forget is that ibuprofen, though available over the counter, is a potent drug that can harm the stomach, kidneys, heart, and even the brain when misused. Let's understand how ibuprofen works inside our body. When you swallow a tablet, it is absorbed into the bloodstream and starts inhibiting enzymes called KIOX-1 and KIOX-2, which produce prostaglandins. These prostaglandins, apart from causing pain, also protect the stomach lining and help the kidneys maintain blood flow. So when ibuprofen blocks them, pain and fever go down, but the stomach and kidneys lose some of their natural protection. This is why long-term or high-dose use of ibuprofen can irritate the stomach, cause ulcers, and even lead to internal bleeding. One of the most common side effects of ibuprofen is stomach discomfort. Many people who take it regularly experience nausea, acidity, heartburn, or stomach pain. In more severe cases, ibuprofen can cause gastritis or peptic ulcers, painful sores in the stomach or intestines. If these ulcers bleed, a person may vomit blood or pass black, tarry stools. Such bleeding can be life-threatening if not treated in time. That is why doctors often recommend taking ibuprofen after meals and never on an empty stomach. Another major concern with ibuprofen is its effect on the kidneys. The kidneys rely on prostaglandins to maintain proper blood flow, especially when the body is dehydrated or under stress. When ibuprofen blocks these chemicals, it can reduce blood flow to the kidneys, leading to kidney damage. In some people, especially those who already have kidney disease, diabetes, or heart problems, ibuprofen can cause sudden kidney failure. Combining ibuprofen with alcohol or other painkillers like paracetamol can make this risk even higher. Long-term use of ibuprofen also affects the heart and blood vessels. Research shows that high doses of NSAIDs can increase the risk of heart attack and stroke, particularly in people with existing heart conditions or high blood pressure. This happens because ibuprofen can cause fluid retention and raise blood pressure, putting extra strain on the heart. For this reason, people with cardiovascular diseases should use ibuprofen only under medical supervision and for the shortest possible duration. Another often overlooked side effect of ibuprofen is its impact on the liver. While liver toxicity is more common with paracetamol, ibuprofen can also cause mild liver enzyme elevations and, in rare cases, serious liver damage. This risk increases when ibuprofen is combined with alcohol or taken along with other medicines that also affect the liver. Apart from internal organs, ibuprofen can also cause allergic reactions in some people. These reactions may include skin rashes, itching, swelling, or difficulty breathing. In rare but severe cases, it can cause anaphylaxis, a life-threatening allergic reaction requiring immediate medical attention. Some people may also experience a condition called NSAID-induced asthma, where ibuprofen triggers wheezing and breathing difficulties, particularly in those who are already asthmatic. Therefore, anyone with a history of asthma should be careful while taking ibuprofen. It's important to understand that ibuprofen is not meant for long-term continuous use unless prescribed by a doctor. Chronic pain conditions, such as arthritis, should be managed under medical supervision, often with additional medications to protect the stomach or other organs. Using ibuprofen daily without guidance can silently harm your body over time. Many people think that since ibuprofen is available without prescription, it's completely safe. But this is a dangerous misconception. The truth is, accessibility does not mean safety. Even water, when consumed in excess, can cause harm. The same goes for medicines. One of the most dangerous habits people have developed is taking ibuprofen with alcohol or other over-the-counter drugs like cold and flu medicines that already contain NSAIDs. This not only increases the burden on the liver and kidneys, but can also lead to severe stomach bleeding. Similarly, combining ibuprofen with blood thinners, steroids, or antidepressants can greatly increase the risk of gastrointestinal bleeding. That is why it's always wise to inform your doctor about all the medications you are taking. If someone accidentally or intentionally takes too much ibuprofen, symptoms of overdose may include nausea, vomiting, dizziness, drowsiness, blurred vision, ringing in the ears, and even confusion or loss of consciousness. In extreme cases, an overdose can cause kidney failure, low blood pressure, or cardiac arrest. If any of these signs appear, immediate medical attention is crucial. Treatment usually involves supportive care, such as stomach lavage and monitoring of vital organs. While I've talked a lot about the dangers, it's also important to acknowledge that ibuprofen is a very useful medicine when used correctly. It brings relief to millions of people suffering from pain and inflammation every day. It allows patients with arthritis to move freely, helps students focus during headaches, and reduces fever in children. The key message here is not to fear ibuprofen, but to respect it, to use it with understanding and responsibility. So how can we ensure safe use? First, always follow the dosage instructions printed on the label or given by your doctor. Second, never combine ibuprofen with alcohol or other NSAIDs. Third, always take it with food or milk to reduce stomach irritation. Fourth, avoid using it continuously for more than a few days without consulting a healthcare professional. And finally, keep it out of the reach of children and educate your family about the importance of dosage and timing. Awareness is the most powerful medicine we have. When people understand how a drug works and what it can do if misused, they make smarter choices. Every year, thousands of hospital admissions are caused by painkiller misuse, not because people are careless, but because they are uninformed. If we can spread awareness, we can save lives. Healthcare professionals also play a major role. Pharmacists should remind customers about proper dosing and potential risks. Doctors should always check for drug interactions before prescribing ibuprofen, especially to patients with chronic diseases. Governments and health organizations should run awareness campaigns highlighting the safe use of over-the-counter drugs like ibuprofen and paracetamol. Let us also not forget the emotional side of this issue. Behind every case of drug overdose or side effect is a human being, someone's mother, father, child, or friend. A simple lack of knowledge can lead to irreversible damage, but knowledge shared is life saved. If each of us becomes aware and helps others understand safe medicine use, we can prevent countless tragedies. Ladies and gentlemen, I would like to conclude my speech with a simple thought. Medicines are gifts of science, powerful tools created to heal pain, cure disease, and improve life. But every tool has to be used wisely. Ibuprofen is a friend when we respect its limits, but it can become a silent enemy when we abuse it. Always remember, relief from pain should never come at the cost of your health. The next time you reach for that familiar tablet, think twice, read the label, and make sure it's the right dose at the right time. Let us take responsibility for our health and the health of those around us. Let us use medicines with knowledge, not habit. Let us make awareness our strongest defense against misuse, because the true cure lies not only in medicine, but in mindfulness. Thank you.